But what an exciting time we're in to where we actually have a solution where we are not delivering double-digit increases year over year. It is not always bad news. That group that we just had that renewal with last week, their biggest decision is, gosh, how much do we lower employee contributions? How many employers do you know that get to say that?
Hello, everyone. Thank you for joining us for another episode of the Healthy Savings Podcast. This is your host, which is a little bit weird to say, Sasha. I'm the co-founder of Milu Health, and we're joined today by Christina Heckathorn, who is an employee benefit advisor and vice president at Employee Benefit Associates, EBA. Thanks for joining us, Christina.
Thanks, Sasha. I'm excited to be here.
Us too. Well, we've had the pleasure of working with Christina and Greg over the past few months and really learning about the things that you guys are doing with your groups in Kentucky. So it's amazing to have you here because I, for one, think that you guys have created something really, really special, and there's a chance to tell a lot of people about it. Maybe if we just get started, I'd love to hear a little bit about you and your background. How did you get into this world? How did you get into healthcare? And we can take it from there.
Yeah. So years ago, I actually fell into employee benefits working in compliance. So think of things like ERISA, COBRA, Section 125. And I worked alongside brokers, and I knew that I eventually wanted to become one. I don't know why, but I did. And especially since there weren't very many female brokers in Central Kentucky. So I actually made that happen. When I started off as a broker, I actually started in fully insured plans, believe it or not. And about 5 years ago, our agency decided that we needed to make a big shift because Greg and I, were sick of delivering double-digit increases year over year to our clients. And we just knew we had to do something different. So now we primarily work in the self-funded and level-funded space.
How was that transition? Because that's not an easy switch, right? Like, for you, for the employer, there's just a lot more work that you guys have to do. How did you go about going down that path?
Yeah, so it's not easy. When I first came into the agency, 10 years ago, we had one self-funded client. And now almost all of our groups over 50 are self-funded, except for 2, which is exciting. So we've really flipped that. But it's important to make sure as you're learning that world that you are not the smartest person in the room. When you're surrounding yourself with people who do know self-funding, right? Because you'll never get ahead and never learn if you're always the smartest one there. So Greg and I were really intentional about who we partnered with. So we work with a company called Health Rosetta, which is changing the way that people pay for healthcare and, the way that we build these plans. And that was they're the biggest and brightest agents and brokers, consultants across the United States. And here we are, little old EBA in Central Kentucky, but we made sure to surround ourselves with people like that were smarter than us. And it was a long learning curve because there's so many pieces to the puzzle, and self-funding it's a lot of risk, and people get scared, companies get scared to do it. But it was really important that we dove into that, understood all the nuances. And honestly, after that, it was learning who are the best solutions partners to partner with, obviously Milu Health being one of those. And it's important to weed through who's legit, who's not legit, who's going to put your client at risk, who's not going to. And that was difficult, but we made it through, and we finally have built a really great program because of those things.
That's awesome. Was it like a switch that flipped, or was it a gradual transition? Like, was it 5 years ago, this is insane, like we've got another year of crazy increases across the board? Or was it okay, there needs to be something different, and let's go group by group at a time based on their kind of comfort and familiarity and walk there?
Well, when it comes to the groups, we always have to move at their pace, because you can't just force a group into self-funding. They have to understand it. They have to feel comfortable with it and know that you have to have that leadership on board. You can't just flip that switch for them. When it comes to us, we weren't just going to go out and put plans in place that we didn't understand, because you could really harm an employer that way. So we dove into the education side for us, as an agency. And Greg and I really learned that. We also joined with companies like BAN, Benefit Advisors Network, and then, Health Rosetta. We really were learning what was working, what wasn't working for other agents and brokers, consultants. And so that was super helpful. So yeah, it's hard to just flip a switch, it's a learning curve. It's like going through college again to figure all this out and make sure you're doing right by your client before you roll something out.
And what's that conversation like with an employer? Like as you're, sitting across the table from them or sitting, on the same side of the table with them and walking down the path, what do you usually hear from them? What are they excited about? What are they nervous about? What motivates them? And then what's been the response, 5 years into it?
Yeah. So the conversation today is very different than it was 5 years ago, because we're way smarter now. But when we're sitting across the table from an employer, it's interesting. Our biggest challenge is that employers have heard the same story over and over again. Let us come in, let us help you. We can save you money, right? But yet no one saves them money because it's been virtually impossible. You can't stay on the hamster wheel and, do the same thing over and over again and expect different results, right? So, when we're sitting across from them and we have so many case studies now, and, our territory is a little different than some of the others across the country because we're working primarily with like 50 employee groups up to 250. So we're not talking like multiple thousand life groups here. These are smaller groups that don't realize that there is a better way for them. And so our model has been built on transparency. So when we can show them that we are eliminating the fraud, waste, and abuse within their plan, and we show them what we have been able to accomplish with other employers, it gets extremely exciting. And then when we get through that first renewal, that's when the light bulb is like, oh my gosh, like I should have done this years ago. And I can't believe we're just now doing it. But in all actuality, they just needed to really make sure that they were making the right decisions at the right time and having the best partners in place, because you can harm a plan by being with someone who doesn't understand self-funding.
If I'm an employer and, someone's come in and pitched me on it, how do I know if I'm going down the right path with the right person? What questions do I need to ask? What are the red flags to watch out for? Like, what should I be looking for?
Yeah. So for the group size that we work in, so say 50 to 250 lives, it's really important to look at stop loss. Does the broker have a direct relationship with stop loss, or are they having, their third party administrator doing all the quoting for them? If you're having a third-party administrator quote your stop loss for you, that's totally fine. But that means that broker probably doesn't have a relationship with stop loss. And that relationship is a finesse. I can't express that enough. You're building a partnership with stop loss because they're the ones who are there to protect the employers. And employers in this size segment, if they've never been self-funded before, which is a lot of our clients, they don't understand that they have to purchase stop loss to cover them as the employer. It doesn't cover the employees, right? So they're buying insurance to protect their bottom line. So it's really important to make sure that relationship is there to ensure that stop loss is going to protect them. And then you have the contract. How does the contract work with stop loss? If I have to go back to fully insured, which could happen, a plan could blow up, you have to make sure you have a long enough runway for stop loss to cover you for any run out time after you make the transition back to fully insured, to ensure that stop loss is going to cover any claims that came in after the end of the plan year. And that's where a lot of clients go wrong. If someone doesn't understand that runway, and we call, the contract is how long, we call it when is claims paid, when are claims paid. So if I'm on a January 1 to December 31 contract, and then that plan blows up and I now have to go to fully insured, well, if stop loss ends on December 31st, but a claim doesn't come in until January or February, the employer's on the hook for that. Well, if it's like multiple thousands of dollars, that could really harm an employer. So we make sure that we have a long enough contract, like an additional 6 months, to allow for claims that come in after they've made that switch to fully insured, because the fully insured carrier is not going to pick up any claims from when they were self-funded. So it's really important to understand how the contract works. What is your risk in it? And if they can't answer simple questions like that, then that's a red flag that's not the right solution for you.
It's funny you say that. I was just talking to someone yesterday and they were telling me about an employer group. I think they were saying it's like a 12-12 or a 12-18 or some term for that. But they had a group where like the stop loss contract was expiring on December 31st and they were going to have to figure out some solution there because they were going to have a gap. And they're like, this is a train wreck waiting to happen. And like, they're late in the game trying to save it. That makes sense. Well, as you talk about the self-funded plans that you guys are building, like what does that solution look like for the employer, for the employee? Like what are the things that you guys are bringing to your clients today?
Yeah. So like I said before, everything we do is built on transparency. When you can pull back the curtain to what's happening behind the scenes, then it's very eye-opening and it really upsets you, right? Because you realize that people are profiting way more than they should. And trust me when I say there is no doubt that companies should make a profit. Right? Like no one's saying they shouldn't, but when those profits are egregious and put on the backs of everyday working people and small businesses, that's just not right. So we design our plans to help, not just the employer in the plan itself, but also to help employees on their healthcare journey. Like that's extremely important. So we have worked through finding the best in class partners when it comes to the TPA, the stop loss carriers we use, the pharmacy benefit solutions. We make sure that they're all working for the sake of the plan and the employees. What we have found over the years is we have this healthcare system and a health insurance system, and they're supposed to work together for the sake of the member, right? But unfortunately, we know that they don't. They work against each other. And honestly, members are caught in the middle. And that's how Thrive RN was born. So, EBA started a new company this past year called Thrive RN, which we're super excited about. And all of our self-funded clients have this program, and it is nurse navigation. And it's there to hold the member's hand. We want members to put their best foot forward with healthcare. Number one, by getting them with the best in class specialist for their condition, what they're going through. And then we also help them financially by putting in programs onto our plans that we build that gets them free durable medical equipment, free diabetic supplies, prescription drugs, all kinds of free solutions. When it comes to getting high quality specialists, we don't ever want to get in the way of getting into a high quality specialist. We want to lead first with that. But when it comes to like durable medical equipment and supplies, a crutch is a crutch. We want to get it at the lowest possible cost and for the lowest cost for the employee. And so those programs are free. But the most exciting one is that we have programs such as Milu Health that assists these members with applying for 501R programs.
Amazing. What are you guys seeing now? Like 5 years in, what are the wins? What are the places where you see continued improvement? What are the challenges? Like how's it all shaken out?
Yeah, so it's very exciting. So one client, I'll give you an example. We have a manufacturer down in rural Kentucky. We actually picked them up during COVID. It was March of 2020, and they, in March it was fine, but then everything blew up right after that, right, with COVID. But they had a particularly hard financial year that year, especially, manufacturers just were hit really, really hard. And so in 2021, when we went through their renewal, we actually took them level funded with a TPA, a transparent pharmacy benefit manager, and pulled that trigger. Every year we have built on that. So they just completed their third year. And it's been extremely exciting working with this client because they have 50 employees on the plan. And Sasha, you wouldn't believe it. I was looking up all the numbers over the last 3 years when I was doing our stewardship meeting with the group. And can you believe that they have saved almost $500,000 over what they would have paid with fully insured had they stayed fully insured?
That's insane. Like the $500,000 for a company that size, that's that would be hiring, I don't know, 10 to 20% more workers,
Yeah. And what's crazy about it is some people would be skeptical to say, well, what are you sacrificing? What are the employees sacrificing by this plan, right? Because how do you save that much money? Well, I always challenge people because their employees get free durable medical equipment. They get free imaging. So MRI, CT scans, mammograms, EKGs, EEGs, all of that is no cost to the employees. They get free diabetic supplies. We partnered with their locally owned pharmacy down in their rural Kentucky county, and they get free tier 1 generic drugs. Now that doesn't sound like a lot to most people, but these are low wage employees. If they're taking 4 prescription drugs on a 90-day supply that's, $10 a month each, we've now been able to save them $120 every 3 months. That's significant to people who aren't making a lot of money down in rural Kentucky. And that's really important to us. So Oh yeah. The other thing is we didn't sacrifice on network either. Believe it or not, they're on the Anthem network.
That's crazy because, you know, one of the things that at least I hear from a lot of these conversations is there's a trade-off, right? Like you can save a ton of money, but you got to do RBP or something else like that where the employee doesn't have the card and the logo. And it's scary. And like there is just, we call it disruption, but like in someone's life, that could be a really bad thing. Sometimes it's the right, you know, decision for the business. Sometimes it's not. But the fact that you can get that kind of savings on the Anthem network, like that's wild.
It is wild. It is. And it, you know, like I said, it has taken us years to build this plan because it's not something you can just rip the Band-Aid off. You know, every year we're adding in new programs for this group. And so what we've done when we first picked up this group, they had 2 health plans and we got them down to 1 because the goal is over 5 years to make that the best plan it can be. There's no reason to have 2 plans. We just want the best plan that it can be. And every year we add more programs. We monitor their claims data to see what programs they need and what we need to add in there. And it's just very exciting. We've got their copays down. Their primary care copay is only $10. Like it's super cheap, you know, so every year their, urgent treatment copays $25. Again, we keep the employees in mind when we're building these plans. We want it to be the best that it can be. And we also want them to have the best possible access and to have that nurse navigator to hold their hand. Because it's, you know, it's hard to navigate healthcare, especially when it's so emotional. So we want to make sure we have someone there to do that. And we do have those nurse navigators available.
The pharmacy thing is really interesting because you don't hear that from a lot of folks, and you don't see a lot of local pharmacies around. Like if I think about the last, I don't know, 20 pharmacies I've gone to, they all start with a Wall or a CVS, you know. But it's such a big deal. I saw there was just a lawsuit. I can't remember if it was CVS or Walgreens, but some kind of massive lawsuit of like 30% of patients getting the wrong scripts at one location, like really bad stuff. If you can keep a local pharmacy in business by having a direct relationship with them, like that's unbelievable.
You know, what's interesting about what you just said is every time I'm in that county, because it's about an hour from me, every time I go down to see the employer, I stop by that pharmacy and shake hands with the 2 owners. And, you know, they did nothing different for us. Like we didn't ask them for any pricing differential because they already had great pricing. There was no need to nickel and dime them. I told them because they kept saying, well, what do we have to do? You know, and my whole thing was just take good care of the members. I want the members to be able to get a 90-day script. They don't have to be forced to mail order. I want them to be able to walk in here and talk to you if they need to talk to you. They're pharmacists, you know, and so that they can trust you. And this is the same pharmacist that goes on site, does their flu shot clinics, COVID boosters, all that kind of stuff. So they know who these pharmacists are. And that's extremely important. But you know what they told me? They said that our plan is the one that pays them the most, but yet our plan has saved $500,000 in 3 years.
That's so cool. Something like that might not scale to like, I don't know, a 10,000 person employer, right. You know, where you don't have a single local pharmacy. But if you think about this employer, like I'm sure it's had crazy other effects. I bet immunization rates have gone up. There's a human that they know who's their person, it's their pharmacist, who's coming in to help them with their health every year, and they trust them. And like that's trust that does not exist anywhere else in our healthcare system.
I know. And I love that. And, you know, it's as we've been able to look at the data and peel back the layers. I mean, people would just be astonished what they see, you know, especially like the cost and everything. And, you know, like I said, we want everyone to earn a fair wage. And unfortunately, our local pharmacies are not. They're being squeezed out by the conglomerates. And believe it or not, your primary care docs, they only make on average 10 cents of every dollar they collect. It's the big hospitals that are making most of the money, unfortunately. And I have a really great example of that.
Yeah. Hit me.
It's interesting, and not to pick on Baptist Health, but they are one of our biggest hospital systems here in Kentucky. So they do get picked on. But believe it or not, a sleep study in Louisville, Kentucky. Now I'm in central Kentucky, but the average cost of a sleep study in Louisville, Kentucky is about $1,750. Okay. A sleep study at Baptist Health, I don't know what kind of equipment they're using, but it must be amazing because it costs $10,000, actually just over $10,000. So on the Anthem network, we'll give them a 50% discount. So for a health plan, the discounted rate's probably around $5,000. Okay. So if I have 5 members on my plan using Anthem and they go and have a sleep study done at Baptist Health, that's $25,000. And members are subject to their deductible and coinsurance on that, right? That is just sickening to think about that. A sleep study. We, on all of our plans, through our durable medical program, durable medical equipment, we can have the sleep study done in home. They actually send the equipment to the member and they can do the sleep study at home. And we can get that for $600. The employee's cost and all of that is $0. And if you have those same 5 members do it at home for $600, we're now talking $3,000 to the plan.
That's amazing.
Isn't that crazy?
That's huge. We see these stats about, hey, a colonoscopy at hospital X costs this amount, and then it's 10 times more at hospital Y. And you see that and you say, that's totally wrong and it should never exist. But, that's just how it is. It's very rare that there's and by the way, it can even be less than the cheaper one by doing it at home in a more convenient setting. That's really cool to provide that kind of option.
Yeah, we find that a lot with like in-home infusions as well versus going to a facility. And then you have to watch how much those nurses are paying if they are doing it in-home for you. There's a lot of price disparity in those types of services. And that's why we're watching the data and we have the nurse navigator so that we can get involved and get them to the lowest cost option, but what's going to be the most convenient for the patient. We never sacrifice patient care for lower cost. That's not the goal.
That's where it feels like navigation is so huge, right? Because no employee is going to know, hey, I've got these options on my sleep study, or, I'm getting this infused drug, but, I could get it at home. Like,
right.
I feel like I know the healthcare system decently well now. I wouldn't know that unless somebody actually reached out and said, hey, just, here are your options and pick whichever one is the right one for you.
Yeah. And unfortunately, a lot of times when people do have sleep apnea and they have to have the CPAP machines, a lot of those companies that are giving them the CPAP machines will force them into renting instead of purchasing, even though renting is way more expensive. And sometimes they'll go as bold as lying to a member and saying that their insurance requires them to rent it. And I've seen that happen before, but we can source it at no cost to the member and for a lot less to the plan. So a free CPAP machine and all their supplies that they have to order are at no cost to the member as well. So like I said, we're not sacrificing anything for our members when we build these plans. It's all about them in mind, and our fiduciary, the fiduciary responsibility of the client is huge. And you had asked me earlier about what a company should look for when they go self-funded. And sometimes it's really hard. Unfortunately, you got the bad actors out there, and it is hard to kind of funnel through that. You need to make sure that you're talking to someone who has multiple self-funded clients, talking to other companies, make sure you're looking at references. But I've got a good example about something that's gone wrong, Sasha, if you want to hear it.
I do.
So back about 3 years ago, we picked up a new group. And, the CFO was very skeptical, and just like every CFO, because they're like, what can you do differently for us? And it's so funny because this group has been such a great client of ours. And I've been so embedded in everything that they do with their health plan that every year we fight over what my fee is. And when I say we fight over my fee, he always fights to raise my fee, which never happens, right? Like, who fights to raise your fee? But they do, because they know, what we're doing for them and how impactful it is, not just to them, but to their employees. So that's not my story, though. That's just part of it.
For the record, I have never heard that. Like that is awesome.
Yeah, it really is. It's great. And I never we are fairly priced for them. I never, ever take advantage of them because I just adore this company and all their employees. I would never do that to them. Again, it's all about transparency, right? So, again, it's really important for a group to understand the ins and outs. So when we picked up this group, they were already level funded with reference-based pricing. So you had talked about reference-based pricing, and we've had groups that are reference-based pricing. So we understand how that works. And again, that is a finesse in itself. So they were already there. The CFO says, as soon as they decided to work with us, they said, I need you to come in and meet with our employees. And I'm like, okay, do we know what we're meeting about? And he said, well, I just want them to be able to tell you what's been happening with them. I literally walked in and it was like a firing squad. I was the one being fired at. And the one
because they assumed it was you.
Well, no, they knew it wasn't me, but they knew that I was new and that I was the one that was going to fix all this. But I will never forget, they asked me if this was a Ponzi scheme. And I'll never forget that, because this group of employees, I mean, this is this employer has like 90 employees. I mean, this isn't like a tiny group. The plan was such a mess when we picked them up that, the employer was put at huge risk from a fiduciary standpoint, huge risk from being sued. And the employees had completely lost trust in this plan. And the reason is because the previous broker, and I would never speak ill of any other broker. That is not who I am. But they were just not equipped to handle reference-based pricing. And some of the decisions that were made by not just the broker, but also the different vendors that were in place were questionable. It ended up not being a good situation where attorneys were involved. So, you have to be very careful. So it's taken us a while to get this plan working the way that it should. The number one thing was to get trust built back into the plan with the employees. They are now on a not just level funded, because level funded is fine, but when you're level funded, the usually the TPA holds the contracts with all the vendors, and we want the employer to hold the contracts, especially as you get bigger. Level funded's a great stepping stone, but understanding that self-funded means that you hold all of the contracts, that's crucial, as the employer. And so they are now truly self-funded, and they are on the Anthem network, which I mentioned that because, again, we took them from reference-based pricing over to Anthem. That was part of, a small part of the issue, but making sure that we're instilling trust into the plan. We got them down to one plan design, again, making it the best plan design that it can be. We've lowered the copays. Every year we're making changes that makes it better. So every year when I go in there, I'm like, okay, guys, this year, this is what we're doing. The following year I go in, this year, this is what we're adding. So every year we're making it better. And this plan has been running amazing. And, it's finally got where it needs to be. But it took years, and I had to work a lot on this group. And that's why the employer says that I should make more, because it did take a lot to get it worked through. We had a lot of employees that were in collections over things that were balance billed or that were things that the plan should have paid. I mean, I tell you, it was a mess. And, to no fault of the employer, they had no idea what was going on behind the scenes. And when I was able to peel back the layers and show them, it was very disheartening. So they're a client for life is what I like to call them. So I just wanted to tell you about that, because it's, you have to be very careful, and you'll hear these horror stories. So important to get with a good consultant.
So you're in the past, when the plan wasn't working, employees would go somewhere, they'd get a service, and then on the back end where, the vendor is supposed to work with the hospital and work it out, it just didn't get worked out, right? And then the employees ended up getting stuck with it.
Yeah, so that was part of the issue. The other part of the issue is that the TPA wasn't doing timely processing of claims. Provider would send in a claim and it would never get paid. And so then they would start billing the employee for the full amount, and then they would end up in collections, and it just spiraled. And I'll tell you, Sasha, I am a super nice person, but when I find out that people are in collections for things that are not their responsibility, Mama Bear comes out. And it is not pretty. Of course, I would never say names on a podcast like this, but, obviously we would never work with a TPA like that. And I take that very seriously. And, when we look at ERISA and ERISA responsibility, ERISA does not penalize a TPA. They penalize the employer. And so when an employer finds that out, their only recourse is to change TPAs. And if anyone is harmed, they can sue the TPA to get paid back for what they were harmed, but nothing beyond that. And that's sad. That's really sad. So there are no protections for the employer.
So you need to have a great TPA, and you need to have someone by your side that can kind of walk you through, hey, I've been down this path, and these groups are amazing and these groups are, not so amazing at this specific thing. Do the employees trust the plan now?
They do. They do. Yes.
Amazing.
It has taken a long time to get it turned around. Collections is a lot. That's tough. You're changing people's lives, their ability to buy houses and cars and have credit. And, it takes a while to change that around. But, the leadership team is amazing and we've got it turned around.
That's really awesome. When you, in the example you mentioned before, the $500,000 in savings, when you kind of think about that as like a bar chart, like where do most of those savings come from? Is pharmacy the biggest chunk? Is that, one of multiple chunks? Like how does that typically look for you guys?
Yeah. So pharmacy is the low hanging fruit, right? So if I can change who is sourcing your pharmacy, like your pharmacy benefit manager, the programs that we're bolting on around pharmacy, whether it's international pharmacy or just sourcing it differently, that I can usually save upwards of 20% of your cost of your overall plan, not just your pharmacy spend. Unfortunately, pharmacy has become such a high dollar expense within these plans, because we have all the new latest and greatest drugs coming out, which is wonderful. But unfortunately, we have doctors that are prescribing these things left and right. And, we need to make sure to keep that in check for the sake of the plan. And companies have a fiduciary responsibility. So when it comes to pharmacy, there are within PBM contracts, you can find of all the really big ones. There are about 32 different ways that they hide revenue. And that's really sad. That's why it's important to be with a good pharmacy benefit manager, and you can tear apart those contracts, have that contract reviewed. But pharmacy is the low hanging fruit for sure. And then, having programs in place for like dialysis, for cancer, infusions, if they're having cancer infusions, where they get those, how those infusions are sourced, J codes, all that kind of stuff. It's really important to not turn a blind eye to that because those are very expensive. We can affect things at a small granular level, like giving employees tier 1 drugs at no cost, but that's not what's going to help the plan on the back end. The back end is those really expensive things. So having targeted programs in place for those types of things, like those cancer treatments, and then making sure that they're with the best oncologist, right? Because if you're not with a good oncologist, that definitely is not going to help the long term of that healthcare journey. It's crucial to be with the best of the best that is within your area. So those are the types of things that we're affecting within the plan.
The best oncologist is such a huge one. I mean, it's something that you and I have talked about many times before. But this data, people don't realize this, but this data's out there. And sometimes it's not so cut and dry. It's hard to identify who's the best oncologist, right? But
right.
There is data on who does how many procedures for every procedure you can imagine. What are complication rates? What are mortality rates? For the oncologist, what kind of diagnoses do they specialize in, right? And the average patient has no idea, has no access to any of that kind of stuff, and just doesn't see it. So if you can layer that on top of a plan that's already saving money, it's a game changer, and it's life changing and life saving.
Well, and I've recently gone through that with my own father, and with having to navigate care, and that was a tough situation, and unfortunately, like you said, most people don't have access to that data. I mean, the reason why I had access to it was because we had to purchase it, and it was extremely expensive to purchase the software, which collects CMS data and aggregates all that and puts it together for these quality scores. And we have 2 different programs we pay for. And then plus we have access to Milu Health. So between the 3, we're able to paint a picture of what that quality looks like. And, most people, they just trust their doctor. The doctor is the number 1 trusted profession out there. And if they're saying, hey, go to X specialist, that person's probably going to go to X specialist, no questions asked. And unfortunately, that's just who the doctor knows to send you to. It's not because they know what their quality is. It could be because they're their golfing buddy, could be their neighbor, it could be someone part of the hospital system they're affiliated with. It could just be the only name they know, so it's really tough to navigate that. And I'll tell you, what I've learned through my own journey with my father going through cancer is that you can't even trust Google reviews, because like surgeons could have really great bedside manner and that'll get you a good Google review. But if a complication happens in a surgery, 9 times out of 10, we're just blaming the fact that, oh, my dad had surgery, he got an infection. Like, we're not thinking, oh, that's because of the doctor or the surgeon. We're not blaming them. And, but once you can see aggregated data and you see commonalities over multiple surgeries and multiple infection rates or multiple readmissions, then you can start seeing a picture painted, and it's eye-opening.
One of the things that we look at is the outliers. Like, it's hard to tell when things are close and when different doctors see different patients. Like, that part's not black and white. But when you look at folks who just have widely different metrics for the same stuff, you start seeing something really, really meaningful. And that's where you can impact patient decisions in such a huge way.
Yeah, absolutely. Well, and you talked about, the number of times that they're doing certain procedures. So if I'm going to an orthopedic surgeon and I'm needing to have a knee, replaced, well, if they specialize in shoulders and only do like a knee once every year, they may not be the one that I want. I want the one who's perfected it and does the knees a lot, right? So that's where it becomes really important to be able to see that kind of information. People can ask that question, but most people don't. They don't ask their doctor, well, how many knees, replacements have you done this year? So it's just not something that we know to ask.
And it's uncomfortable. Like, I saw this with my own family. And it wasn't even that uncomfortable of a question, but you're in a very vulnerable situation. You're afraid to ask. You're afraid to challenge. You think that you're going to get worse care by asking that kind of stuff. But the numbers are out there, right? You can see, hey, this person's top 10% in their area for doing this kind of surgery. Amazing. Right. Or this person, like, actually, is number 17 out of 20 in the town for doing that surgery. Like, right. That's there too. That surgeon is operating on people. So it's huge stuff to understand. What are some of the things that you're excited about going forward? Like, as you think about with your existing groups or with new groups, as you think about, your plans continuing to evolve, and with some of these employers, when you sit down with them next year, like, what are the things that you're going to be talking about with them and thinking about with them?
Yeah. So next year will be interesting with our current clients, because then we're going to really be able to see the data of the Nurse Navigator and how that program has worked out. And so that's very exciting for us we've had great response, but we want to be able to see data. We want to be able to get all the feedback from the employees, from the employer. So that's what we're looking forward to with our current clients, because that was a really big, obviously a huge investment for us to make with starting ThriveRN and doing that on our own, other than just because we wanted to have control over that for our groups. And our nurse navigators are just for our groups. Instead of hiring someone that we have no control over, that, because we want to make sure they're delivering a certain type of service. As we look to new groups, I can't tell you, Kentucky, like, we get a bad rap in Kentucky, right? We're barefoot and pregnant, and so it's an interesting state. Although we have beautiful horses and lots of bourbon, and beautiful countryside, it is a beautiful state. But we are a poorer state, and we're a very unhealthy state. And so when I think about getting this type of program out, it really excites me, because I know we have a niche. I know we have built something amazing. We have worked through all the kinks. We have all the great partners in place. We're still, putting in new partners as they come along and can help our groups. And as we analyze the data, because we're looking at that data all the time, we're constantly monitoring that and getting counsel from all of our partners to make sure we have the best in class partners out there. But it's just really exciting to think that more and more Kentucky groups can take advantage of this. And of course, we are not just, confined to Kentucky. We can take this anywhere. So it's just a matter of getting the word out to employers. And that's our biggest challenge, is how, weeding through the noise of what they've heard before. But we have these amazing case studies and the savings are real. The unfortunate thing about self-funded is that it works a lot like the stock market, right? For every 10 years, you're going to have one bad year. Although they say in self-funding now and with healthcare rates going up and all of the blockbuster drugs that we have, that it's probably more like one in every 7 years is going to be bad. But that's okay. Because like we just delivered a renewal where a group saved, they had 200,000 in reserves that they haven't spent in claims. And this was a group that has like 50 employees on their plan. It was the first renewal we've delivered. They saved like 700,000 off fully insured rates. It was just stupid renewal. Like we get so excited about it. But they're going to have reserves. And I just reminded them, keep that in reserves because eventually you'll have that bad year and you'll have that money there, to protect you, which will be great, for them. But what an exciting time we're in to where we actually have a solution where we are not delivering double-digit increases year over year. It is not always bad news. That group that we just had that renewal with last week, their biggest decision is, gosh, how much do we lower employee contributions? How many employers do you know that get to say that?
None. Like I literally have not heard that. It's so cool. It's so
exciting.
Cool.
It really is. And I was telling the group, like, we're excited. And the CFO says, well, I don't know that I'd call it excited because, they're still very nervous because it's all so new to them. And they're like, when's this going to blow up on us? But it is exciting. Greg and I get to lay our head on our pillow every night and know that we are doing the right thing. And that's exciting for us. And yes, we are small, but we're mighty. And we are not, we don't have Big Brother over here of corporate breathing down our necks saying we have to do things a certain way. I can't tell you how many broker firms are so fixated on what are bonuses? Like, how much do we have to sell for this carrier to get bonuses? We don't get bonuses on self-funded groups. It's just what we tell you it is. It's a per employee per month that gets billed by the TPA. It's very transparent. You see it. So we actually lose bonus money. But that's not why we do it, right? We do it because we're saving companies money. And then we get the ones like my group in Louisville that begs us to raise our rates every year.
That's awesome. I mean, I literally heard that 2 days ago. Someone was telling me, hey, they were someone who was at a big firm and now they've struck out on their own. Their first year doing it, but they had amazing solutions for their clients. And then they just got chopped down. They were told like, no more. Like there's a bigger thing that's over your head and you're messing with it. So you got to stop. And they're like, what do you want me to do? Deliver a worse result for my clients? And the answer was yes.
And that's what we're competing against because, groups feel like, and I understand like the really large companies, they want to be with like an Aon or a Gallagher, Marsh, whatever. But that's not always better. It really isn't. I mean, we're consultants, we're licensed consultants, and we're always going to partner with people if it gets out of our hands. Like we're going to partner with Smarter and make sure that we have people in place to take care of their groups and be able to scale that way. But it's interesting because some people really are blinded by the fact that they think that bigger is better. And honestly, it is not. And that's what we have found. So we're
awesome.
Excited.
Well, Christina, thank you very much. This was amazing, and honestly, the stories and the case studies that you and Greg have are absolutely astounding, and I can't wait to continue to hear about them and see what happens next year and the following year. It's going to keep getting better.
Thanks, Sasha. I appreciate you getting the word out. It is exciting, and we appreciate our partnership with milu and look forward to more and more groups together.
Awesome. Thank you.
Take care.
Thanks for listening to Healthy Savings by milu Health. If you would like more information about any of the topics you have heard today, we would love for you to get in contact with us. Find us on the web at miluhealth.com.